topic because it only comes under your scope of practices. Remember, this is not under the LPN scope of practice, but what the LPNs can do it, definitely they can do a lot of stuff, which I'll talk about in a brief. Now, in points to remember here, a lot of things in here to read it, but I'm just going to explain it in short way. But whenever you read these points, it's the same exact meaning, what I'm talking about, but I will explain in the easiest way right now, right? Without even looking at these points. So maybe just try to listen me more, whoever watching this presentation. So the first thing I would say is remember, what do you need to know as an RN? And how to start the procedure. What do you do before, during, and after? These all things can be asked by the NCLEX, right? And what's your role? What's LPN role? What do you do in case of an emergency? How do you know it's an emergency? So those kind of famous questions for the NCLEX, right? So remember, first thing is, once you get the physician order, you need to make sure you explain everything to the client. Get the informed consent, right? If the client is conscious, awake, and they're pretty much okay to answer you, they know why they're carrying it, definitely they need to know, right? Without explaining the patient how we can enter in the room and just poke the patient, no, it's a bad idea, right? So definitely get the informed consent, and after that, if possible, as I said, and then after that, then I will get the patient blood work done for the blood and blood group type. We need to check the compatibilities, blood group type, RH factor, sorry, not the RH factor, but the ABO blood group we need to done, the cross match. So we can get the accurate, the same bag what we needed, right? Once you do that step, now remember that thing is only good for 48 hours. If your patient not getting blood in 48 hours, you need to repeat this test again, okay? Now, the second thing what you need to know is the next step is, after you've done this step, now you need to do some steps before starting the administration, right? Now, what are the steps before starting? Definitely go and get the blood bag, right? Remember, in the NCLEX, you cannot delegate someone to go and get the blood bag, not even in case of an emergency. You have to go by yourself as an RN, okay? Because this is all about the safety of the client. So you go by yourself after you check all the patient details, room number and everything, patient name, identity numbers, and so and so. Then you go in the blood bank. Now the first verification will be done in the blood bank with the blood bank person. Whoever they give you bag, you check everything on the bag. Now, what do you check on the bag? It's already saying the last paragraph here, if you see it, right? I'm going to talk about the second last line. It says your client name, date of birth, blood bank number, unit number, expiration date, right? And even the blood type, group, even the doctor's order. Everything you need to match with them. Okay. Sometimes the NCLEX can ask you here starter question. So you need to know all these things, what to check, right? And then after you check with the blood bank person, remember when you bring your blood bag back to the nursing station, remember it's only good for 30 minutes since you got from the blood bank. That means within 30 minutes, half an hour, you must need to initiate the blood bank, because if you're not initiating it, it's gonna go bad, right? And then you have to return it to the immediately to the bank before the 30 minutes going to be over, because you don't want the bag to be wasted. Let's say for some reason you cannot start it. Maybe your IV's line is bad, you need to start it again, or maybe patient is not feeling well right now. Like it could be any reason. So if something happened and you know you cannot start within 30 minutes, better turn the bag immediately. And this is something else already asked a question before, just so you know. Okay. And then once you took the bag from the blood bank, as I said, within 30 minutes, now what is the next step you're supposed to do before you initiate it? The next step you're supposed to do it is one thing I forget to mention is before you go to the blood bank to get the bag, you need to check the vital signs, first set of vital signs. At that time, then go to the bank and then get the blood bag. But when you come back to the nursing station, before you initiate the procedure, second set of vital signs. Now, second set of vital signs done, you make sure your patient is still fine, everything okay, then initiate the bag. Now, when you initiate the bag, remember, there is a special tubing. We use it for it. That tubing, we called it Y tubing. Y, capital Y. So write it down, capital Y. Yes, this capital Y tubing we called, right? Why we use the tubing as a capital Y in shape? Because on one side we hang blood bank, on the other side we hang is the normal saline 0.9%. You can draw it in your books, Y kind of diagram in shape. On the one side, hang it blood bank, on the other side, hang 0.9% normal saline. Remember, it only has to be 0.9% normal saline. You cannot use the dextrose. You cannot use the hypotonic or other hypotonic solutions, but it has to be isotonic 0.9% solution. Why we hang this one at the same time? Because in case of an emergency, if you need to flush the line. Now, what is the purpose of this Y tubing? Because it has the clamp on both sides. When the blood bag is on, the normal saline is off, right? You only turn on the normal saline when you need to flush the line, either after finishing the bag completely or either in case of an emergency. That is the purpose of this tubing. So you don't need to make another line, hang it again, because you don't have time enough in case of an emergency to change the lines again. So this is a smart way, to flush your line. So that is something we need to use. Now, you already initiate the bag, right? Now, when you initiate the bag after checking the second vital signs, remember, you initiated at 2 ml per minute maximum. 2 ml per minute maximum. That is the rate at which you're going to start it first initially. For first 15 minutes, 15 minutes. Why you do so slowly initially? Because you want to check for reaction, right? Once you see reaction, you stay there for 15 minutes, you see nothing happened to your client, everything is fine. Then took the third set of vital signs after 15 minutes. After you took the third set of vital signs, after that first 15 minutes, you think vital signs is also okay, everything is fine. Now increase the rate as per the doctor order. Why I'm going sequence step by step? Because NCLEX can ask you, this is done, what you will do next. Then everything seems nice in the answer key, then you don't know what to do next. So you only know if you know the steps, right? So definitely increase it as per the doctor's order. Usually doctor order maximum 10 ml. They don't order more than that because fluid overload gonna be happen. Now remember, once you increase it and you feel like your patient is fine, now you can delegate to the LPN. Now I'm going to talk about a little bit about the delegation process at the same time. Now you can delegate to the LPN. LPN can take over because your patient is fine, your patient is stable, you already checked everything. And LPN, what they can do is they can maintain it further. That means they can stay there around, they can maintain it but they cannot initiate it. It's everything done by the R. That means LPN only can maintain it. The second thing LPN can do here is, in case of an emergency, she can stop it and she can flush the line and she can call you, right? That is the only thing LPN can do with the blood transfusion person. Otherwise, LPN has no other role in the blood transfusion reactions, right? So the rest everything done by the RN. Now, what else you need to know for this one? Yeah, one thing I forget to mention is, in case you are wondering and you need to know, one blood bag has to be finished within 4 hours. We cannot give it after 4 hours. So if something left over, you need to discard it. Write it down how much you entered in the client, how much is there, how much you're discarding it. Everything should be documented. And the one bag is usually quantities 500 ml. 500 ml. This is the maximum NCLEX can ask you, right? Now, another thing I just remembered when I look at the slide is, sorry, please add up. When you come back after taking the bag from the blood bank, before you take second set of vital signs, there's a one step I missed. You need to do another verification with the nurse on the floor for the bag. And it has to be another RN. No LPN. Sorry, just a second. It can be with the LPN also, but the one minimum RN in two nurses, right? So either one LPN, one RN can check together, or either two RNs can check together. Okay, I apologize for missing this point. But yeah, it has to be verified back again on the floor with another nurse before you take vital signs, before you initiate the blood transfusion. Okay, so I hope it's all clear until now. In these two slides, everything is same. Whatever I talked about is just for reading now. So I recommend it. Please read it. And if you have any question, you can ask me later on back again. Everything I write it down here more in detail. But something if I missed to write down in the slides, I already cover up in this presentation. So I recommend to make some notes if you can. Now the next thing definitely you need to know the signs of reaction, because if you don't know, then how you can stop it, how you can take the nursing action. So this is the maximum list what can happen with your client. Just skim and scan. In short, I would say anything happening with your client, right? Anything happening with your client, we need to stop it, right? Starter questions can be asked on this thing pretty easily. Like they can ask you which of the following are the signs of reaction, select all that apply. So this question can be easily come over. So please look at the list. And in case of an emergency, what are you supposed to do? This is what you're supposed to do. The first step I would say here is discontinue immediately. It does not say on the slide, so please write it down. The first step is discontinue immediately. And after discontinue, the next step is raise the head of the bed, raise the head of the bed, and assess your client for the other symptoms. Assess your client for the other symptoms. Take vital signs. Take vital signs. Obviously, if the question already tell me the breathing difficulty is there, then I'm not going to take the vital signs. Then I'm just going to raise the head of the bed and put the oxygen instead, right? But sorry, before you raise the head of the bed, before you do the vital signs, there is another step which I forget to tell you. After you stopping it and immediately, the second step has to be flush the line immediately with a normal saline and keep the vein open. Flush the line immediately and keep the vein open, KVO. Okay, and then you do the rest of the stuff, assess your client, vital signs, or it depends if the oxygen already down, then maybe you want to put the oxygen first, right? And then you stay with your client, until the patient doesn't feel better, and then definitely you need to call the doctor also in here, right? Doesn't matter, only small reaction happen, you still need to call the doctor, and definitely you do documentation, incident report, everything at the end, because that's what happened. And the one thing another important is you need to inform the blood bank also if any reaction happen. And the set you need to not to discard it, you need to return back to the blood bank, yes, including the tubings, so they can analyze it completely. I hope everything is all clear under this topic, right? Perfect. So that's all about it today in this fundamental slide. And again, if any questions further after watching this presentation, please feel free to ask me the question. You can contact me further on the WhatsApp is the easiest way. And the WhatsApp contact number is the country code +1 780-616-1500. And my email address personal, if in case you need to email me, that is the nursingworldreview@gmail.com. Thank you so much for watching this presentation.